Hi. So, this is a small tip on what are the post-op instructions that you can give after placing a stainless steel crown. So, the first and foremost one, always inform the parents that there may be some amount of pain post-operatively because even though the tooth is root canal treated, the crown is going to impinge the gingival tissue. So, the child can complain of pain. So, always prescribe them painkillers. The second point can be tied up with the first point, that is, the child may still complains of pain on the second and third day, but tell them, reassure the parents that that is actually not the pain. It's because the patient will feel some sort of irritation and difficulty because there is something new in his mouth. So don't give him antibiotic or don't give him painkillers just because he says it's pain. It's not actually pain, it's kind of irritation, and the child will itself get adapted to the newly placed crown in 2 or 3 days. Now, point number three, always inform the parents that, especially if you're placing a crown in a relatively younger patients like a 4-year-old or 5-year-old child, tell them that it's a long journey of 5 to 6 years. So somewhere in the middle, like once or twice, the crown may get loosened. So all you have to do is just bring the patient to the clinic. We will refix it. Now, point number four, that can be tied with the point number three, that if you are placing a crown in a primary second molar in a patient whose age is under 6, that means in a patient whose permanent first molar has not erupted, tell them that always there is a chance while the eruption of the first permanent tooth is happening, it exerts a lot of pressure on the teeth which is immediate next to it, that is primary second molar. So during this eruption, there are chances that this particular crown may get moved or it may get loosened. So you have to bring the child to our clinic and we'll fix it. Now, why do you have to mention that during the eruption of 6, the crown which is placed on E will move? Does it really happen? Yes, it does happen. Actually, that's the purpose, the whole purpose of doing this video. I have seen multiple cases, like many of my patients whom I have placed a crown 2 years back when they were 4-year-old, 5-year-old, they are coming back saying that the crown is moving. So the only change that has happened to the patient's mouth is the 6 was erupting. So I had seen this 4 to 5 cases, though I have not learned it before. So now I'm learning it that the pressure of eruption of 6 is immense, and that exerts the 6 eruption of 6 exerts a lot of pressure on E. And if the E had already a crown, and there are high chances that this crown will get dislodged. So just inform the parents that this may happen when the child is having his first permanent teeth eruption. And always understand that a pre-informed parent is always calm, but if the parent is uninformed, they may be violent. So that's it. Those are the 4 post-op instructions that you can give to a patient who might undergone a stainless steel crown placement. And before that, make sure all your pulpectomy cases are getting a crown.